Okay. All right. Thanks, everybody. All right. So I'm up next here for the OHA integrated eligibility update. I wanted to bring up a couple. I'm going to tie both of these first two together. One is you see the hyperlink to our to the normal normal dashboard that has been available. This showcases the progress and work that's being made. A lot of the focus is on things accomplished and call times and wait times and things like that. The next update is really connected to the backlog. There is some work being done to create a public-facing dashboard that addresses the backlog more directly. So that will show outstanding tasks, outstanding applications. It's also supposed to break it down by Oregonians waiting. Like, are there pending items that are waiting that aren't affecting eligibility, meaning the member can still access services, or is this something that's preventing them from accessing services? So that's in process of being made. As soon as that's available, I will email it out to this group and make sure that you know where it is posted. I'll also add it to this agenda so it'll be continually a part of our ongoing material that you can access as well. As far as progress around the backlog, most of what's been happening the last month has been in the planning and kind of refocusing of staff or strategies. There is some work being done around how a contracted partner can be enlisted to help combat some of the call volumes. I think the intent there is to kind of create a triage system where there is a large group of staff trying to get connected with people, help them navigate the tools that are out there and maximize them. But if they need access to an eligibility worker, that is passed on then in a warm handoff system. The intent is not to create double call waits, if that makes sense. Is really to create this kind of triage system. That's in the process of being built, and we'll have more updates on that again next month. But those are kind of the major activities that are happening that I wanted this group to be aware of. That I think will also give you the dashboard, especially give you access to information that in your own call centers or in communications with members, you'll be able to work with them and help them understand the situation as best possible. Any questions on that piece before I move on to the next subject? Okay, so the next is just an update to the metro area enrollment talking points. We talked about it last month, and the situation has been modified since we last spoke. As of January 3rd, enrollment has moved back to how it was for November for the metro Portland area. So you can request any CCO again in that area for enrollment. So that was just a brief pause. So be sure that you are not messaging to members that is ongoing, because it has been changed. Any questions about that piece? Okay, the last one for me is around the building reopening update, and there was plans again for January as our target, but that has been moved back. It happened just right before Christmas time, I believe. The decision was made to extend that. So we are not going to be moving back into the reopening. We're still following some of the public health emergency guidelines as far as coming back, but I think we were tentatively planning for January, but that target has been moved out. I have not heard a new target date as of now, but we will update you guys as we get closer to that. In the event that we do, this would move to a hybrid of online and in person as safely and as possible, and I'm sure a variety of other meetings would as well. Barring any other restrictions or advisory options. So that's all I have. I have one more brief OHA update I want to mention, is that we do have some new staff joining our CCO operations teams. They're just starting to onboard, but one of the roles is Shauna McDermott moved to a new role in behavioral health, but we do have a new manager taking her place, and so they will be introduced here in the coming weeks. And then a couple other members of Veronica's team as well will be joining us. So that's exciting. A couple of these positions that have been in motion for quite a while. So we're really happy to have those new folks on, and we'll be introducing them more robustly next month. Okay, so the next topic, Siri popped me up, and they are unable to make it until 3. So we are going to move that action item down the list a bit, and I will just move right into my next topic. And actually, Dana, do you want to give some context about how this topic ended up on the agenda? This is around alternative member contact info.
Yeah, so this came up during the QHawk meeting on, I guess it was Monday of last week. And it was in the context of when there were the wildfires last year, there were a lot of people who were displaced out of their homes. And we needed to, we, OHA, plant, CCOs, everybody needed to find a way to contact folks that wasn't necessarily their landline or mailing to their home because they had been displaced. So OHA is looking at ways to add alternative or emergency, like temporary contact information for patients or for members. And so we talked about a little bit about it in the tech work group this morning as well. It sounds like the idea is to include well, I think OHA is still trying to determine what that information would look like, but it's a mailing address and or a phone number that would be a way to contact people. And it would also be, it would not impact their eligibility. So for instance, if they had to, for instance, move to another county or out of the service area, it wouldn't impact their enrollment. So those were kind of the highlights we heard this morning. And so, but that's the context is being able to reach people when they're displaced.
And I think you're exactly right, Dana. In my research before our meeting this morning, too, with what Mary had spoken to, is that the intent is to not adjust the residential and or mailing, is to create a third option that doesn't disrupt any of the existing enrollment or eligibility that is there. But it sounded very much in the preliminary planning, and I reached out to Vivian Levy this morning too to say, hey, is there any big piece of information that would be useful at this time to offer this group? And she didn't think that there was. I think it would be great to get from this group, if there was a prioritized list of information beyond the address and phone number, it would be something that you would like us to consider. I wondered if email, which is something that is not currently included, if that's something that if we prioritize that would also add another level. So I would love to get that feedback from the group.
Yeah, I think email is an obvious one. I mean, I think there's a lot of ways people can access that still, even if they're, somewhere else. But I'll let the rest of the group chime in.
Yeah, this is Jen from Care Oregon. I would completely agree. I think, capturing email and even we've talked a lot about this, and I know it's been an ongoing conversation between our company and you all is around even consent for text messages. I know you guys have one for OHA, but if there was even some language in the form that they fill out to say and the CCO or something like that, so that it doesn't have to be double consent. I don't know if that's messy or not on your side, but I know we've talked a lot about that. So definitely email, and if there's some sort of way that we could roll in text message consent, that would be awesome as well.
This is Jake from Pacific Source. I would second both those comments. Email obviously being a really important one, but then the consent for text message would be a really nice thing and prevent the duplicated work there.
Hi, this is Sheila from AllCare. I think, yes, those are great, but if we're talking about an alternate address, how would we know the email is an alternate address for them, or notification or contact information? I think there's going to have to be something developed in the 834, and I think that's probably what they're looking at, so that if a member is having to move out of the service area due to a disaster of sorts and they need services, how would we know that they would still be able to obtain services out of the area, and that it's an alternate or temporary placement with the company, because you talk about transportation, you talk about dental, you talk about medical care. So we definitely want to be able to identify a temporary address as opposed to their permanent address.
I see, Sheila. So you're citing that not, with this information, would it either have a flag saying this person is displaced due to circumstance X, or Y or Z, and it's not just a third address. Like you would want it to be clearly denoted that this is due to this situation. Is that what I'm hearing?
Yes, for continuity care purposes, especially because you're talking about, transportation. Would we still be able to provide transportation out of the area? Would we be able to, connect them with, with medical out of the service area? So it's going to involve contracts and things such as that. So yes, we would definitely want to know that this is a temporary address, but it's still a valid member with our particular company.
And this is Sybil with UHA. I do have a question as well. Will there be a time frame for this temporary living situation? I would hope it wouldn't be an indefinite ability to live outside of the CCO area.
So we'll tag that as a question to answer. I don't know the answer to that, but like, if we make this change, will it also have some sort of predetermined time limit, like a 90-day? And if they still reside in that area, doesn't mean they need to, enroll in the CCO for that area at that time. I'm just making up a hypothetical, but yeah, will it have some sort of rule that or policy that governs what the length of that temporary displacement is before it turns into just the need to re-enroll? Because at some point it could, the balance between temporary, it could just be better for the member at that point to look into the re-enrollment depending on their situation. Okay, great. Lots of good feedback there. Thank you all. Okay, if there's no other questions there, we're going to keep rolling with member info, and I'll pass it to Kelly.
Thanks, David. Yeah, so to kind of go along with, David's last topic, I'm hoping to open discussions with other CCOs, hoping to collaborate and share if any CCO has been successful in some sort of member campaign of updating member information. We have struggled with, which I'm sure many other CCOs have, with a lot of return mail and having, not up-to-date mailing addresses for members. And I know this topic also recently came up during the CCO operations call earlier this week in regards to redeterminations. So I'm curious, I guess we can start off with that. If there are any CCOs who have done some sort of marketing campaign to encourage members to update their info with OHA.
Kelly, just since no one's really just jumping in yet, one of the other questions I have too is, what do we do with that information when we get it? Like if we're encouraging people to update their information, how do we know they're doing it? Because presumably the only way they can do it is to call OHA directly, or go on to the patient portal, or go through a community assister. And so as far as I know, the CCO or the dental plan isn't notified necessarily that someone has gone on and done that. So
Sure.
it'd be good to know what OHA would be able to do as far as provide gap lists, or provide if there's a good feedback loop that here's all the letters we got back this month, what can we do with them?
Yes, that's a great point. Thank you, Dana. Yeah, we have internally discussed, if it's possible, or if OHA encourages us, the CCOs, to direct members to their website to update that information, and whether or not we put a link on our page and see if we can do some sort of tracking to see if members are linking out to the OHA website to update that information. We've considered that potentially as being a tracking point, but I guess, determining which is the best route to direct members to update this information on. I'm not sure if it's an easy portal update for members.
One of the pieces I committed to, and I'm working with ODHS, is getting a one-page, and there's some great material they've worked on. I'm not finishing my thought. I'm sorry. It's getting a one-pager that gives encourages the use of the applicant portal. That is, their online portal that once they have active benefits, they can log in and update information with. But it's getting a really condensed version of that direction, right? Which is something that if you're going to create a mailing of some kind, or you're talking to somebody, you can reference and say, hey, you can do it on your own using this system. Because it does feel, it's a hard time to say, hey, we want you to keep updating your information, and we also have these other challenges around wait times. And if that's like the mode, right, it's hard to say, well, we really want to encourage people to give us this information, because this will get, as we get closer to the public health emergency ending, it is really, really important that they keep updating not only their address, which is great for communication, but all the other pieces of information they have, because they're going to be using that information to do some of the more passive renewals. And the more up to date that information is, the cleaner and faster some of those processes can go. So it really has a bunch of benefits, but trying not to just funnel people to the phones is kind of the real challenge. So they're gonna produce a document that's really condensed and something that we can all lean on, because I think that's an opportunity. I don't think it's the saving grace necessarily, but it is at least something else, another tool we can put out there.
Perfect. Thank you for that information. Oh, go ahead, Dana.
Sorry, I was just going to jump in and say, do you know whether the application assisters, the community partners, are called out on that one pager as far as, because I know that they're also very helpful in getting that, getting members connected and information updated.
Yeah, the intent's to kind of gear towards, if you need a community partner to help you do this in person or over the phone, you can try and work with a community partner in your area as well.
Great.
David, do you think that, excuse me, I was just wondering if there was a thought on OHA's end to create a template message or a template communication that can be added to CCO websites and OHA websites, so that member would, other than it flashing at them or something, to update their demographic information, their addresses, their phone numbers, because the problem we run into is, we'll get the return mail, but we don't have any contact information. We're not supposed to send anything out to the member with this new address that may come back to us. The phone number is many times disconnected as not a good phone number. So we really have no way of contacting this member. I do send all of those through the Oregon Benefits Portal, the secure portal, but it's very difficult because if they can't get hold of them, they're not going to update that address either. So I just wonder if there's a thought of maybe, so that we all are communicating the same message, that OHA comes with some possibly template language that we could all use to post on our websites, or possibly at least on the OHA website.
Gotcha. Okay, well, let's create an action item here, and I love creating action items for people who aren't here. It's one of my favorites. But I'll chat with Siri around: is there a possibility of a strategy that we can work together on to create a campaign around encouraging the updating of information, and something that we can all lean on? So unified talking points that we can approach, and maybe that's something that Siri will have some ideas around how to strategize on with their communications team.
I think that's great, because if we all are providing the same information to all these members, and not some sending to portal, some sending to phone, some, give them a way of updating this information easy as possible, I think it would hopefully help. I know that all of us old timers that have been working on this for many, many, many years, I'm hoping that we're getting somewhere with a solution to this address issue.
I do have a question. I find that a lot of our members here in the rural area are more comfortable reaching out to the CCO directly and updating their information. So we then turn around and put it on the discrepancy list that we send to OHA on a regular basis. Is that being updated on OHA's end?
So I believe maybe I need a little bit more information. When you say on OHA's end, are you sending this information to the customer service center? Or is there? Okay. So ODHS is the primary responsible party for it in that instance, right? They receive this information. That's kind of, I think this is what Sheila's referencing, right? And their process is that they receive that information and then they try and confirm it with the member. If they can't confirm it with the member, then they don't take action on it.
So even though we have confirmed it with the member?
Correct. They must receive this information directly from the member and confirm it. I think the other hardship to that is that also we're talking about them in a backlog state. This does not get as prioritized as high as of a workload when they have these other competing priorities. So I think that this is something that can be used as another opportunity when they're looking at contracting assistance, is saying, okay, if you're going to get a large group of people to help for, I don't know, 12 to 24 months, whatever that timeline is, can part of this balance of the workforce be how we address some of this demographic work? Because it, in a perfect world, if you're answering the phones within a couple of minutes, it is better if they just zip over and get it done, right? Like if that process was sound. But when you can't encourage that, can this other piece be shored up in the meantime and reprioritized while these other backlog work's being done if we have a larger workforce? So that's something that I will take as an action item. I'm working on the contract statement of work as the OHA rep for some of the operational concerns, and that's something that I can put a voice to in the planning.
And David, I want to state that if they use the Oregon Benefits Portal, secure portal, I do track all of the ones I send in, and then I go back and see if those have been updated. And in many cases, they have. So they do the work, and this has been great for me to see. Again, but they do have to be able to reach the member. But it does happen, and it does get updated if they can verify the change with the member.
That's great. And I hope my statement didn't come off as they don't do anything with it and they ignore it. Like, it's not my intent. I think my intent is to create a accurate picture of the workload concerns that they're working through. And at some moments, this is something that might be set aside to focus on other things. I would be interested too to kind of, look at some of that stuff. Like, this is a deep data hole, but are they recontacting our customer service center after you send that and it gets done that way? Would love to kind of validate some of those things to see how, but I'm glad you're seeing progress on that. And I would just reiterate that I didn't mean to make a statement that they don't do anything, but just that they have a prioritization. They have a lot to prioritize right now.
Hey, David, this is Sheila. I was not taking it that way. I just wanted to know that they do the work. I do see the benefits from it, and it is really great. I keep this, like I said, this ongoing spreadsheet, and I'll go back and update the ones that I know have been taken care of. And it is great to see, because we also do our dates of death that way as well. So just to let you know, they are doing the work. It's slow because, it is hard to make contact with these members at times. But thank you. It's a good conversation.
Wonderful. Thank you, everyone. And David, as potentially another action item, I'm curious too if it would be possible to strategize with OHA on, email and texting capabilities. If we've expressed and discussed in previous meetings and earlier today, I believe, as Jen mentioned, again, best practices for getting consent to start that. As I think that's another method of reaching out to members more efficiently, if we still continue to see this issue with return mail and mailing addresses.
I have that noted for sure in the alternative contact info to kind of, squish that in with that conversation with our leadership. I'm a big opportunist. If you've ever worked with me when there's kind of stuff going on, if we can shove something else that we really want to do into another project, I really like to do it. And then, we could start a whole campaign around just email and texting, right? But if we can kind of, gently nudge it in with another project, then maybe this is a good opportunity, because that could be done, right? You can detach the email communication, not make it just an emergency, right? This is ongoing. Is this something that can we do, or can we at least receive the information and in certain circumstances decide when we can communicate? So yeah, I've got that down for sure.
Perfect. Thank you so much. Other than that, yeah, those were kind of the main topics I wanted to bring up to this group today. So I'm not sure if anyone else has any other comments, suggestions, questions.
I have one little one, and we talk about this sometimes around alternative ways to be communicating that. Does anybody put together things like videos for their social media programs social media platforms that they put out about reminders for Oregon Health Plan members, to-dos, do you do this each month? Anything like that, where we're not just coming up with talking points or emails or things to mail to someone. Is anybody experimenting in that realm? Totally okay if the answer is no. I'm just curious if anybody's spending time doing that. Thanks, Kelly.
Hi, David. This is Kelly. Yeah, so I will chime in and say, EOCCO is looking into kind of developing some other formats for members to digest some of the information that we have on our website, particularly surrounding their benefits, how to work with their PCP and things like that. So that's kind of our goal for 2022, is providing some of our materials in other formats that would be helpful to members, other than, just reading, a flyer or some sort of member mailing. So yeah, having videos is something that we're looking into for this year.
I know Siri is also really interested in visual communication, so that's on my list when I bug them about it. Is there something, an animated video about updating your information timely? I don't know. These are the things I dream of in our future that we can all put on our social media or something like that. So great, thank you.
Hey Dave, this is Jaime with the Ombuds office. I don't want to put Columbia Pacific or Joel on the spot, but I know that they had worked on something, I want to say probably 2 years ago in 2020, and they had some links on their member-facing website that had videos. I don't off the top of my head, I don't remember the topics, but they had started a project like that. So I don't know if we have somebody from Columbia Pacific or Joel, if you have any additional information.
Joelle, you're still muted. Sorry, you're still muted.
Thank you. Every day that has to happen once. So many questions from CCO members, and the CCO perspective is there are so many benefits that they aren't utilizing fully, or don't know how to access, or don't even know that they exist. So this really started as a education campaign with members, new members, attending a series of 6 discussions in the evening. And so they piloted it, they developed all the content. Each session was devoted to a different topic. So one was really family focused and pregnancy focused. Another was on the dental benefit. Another was on NEMT. And they didn't get a whole lot of community engagement with that, but they did get a lot of participation by community partners, OHP assisters at the community level, who didn't know what they didn't know about their own CCO in their area. And so they requested that the content be tailored to them or available to them as they were assisting members. They would know better what the CCO did. And so they went through and re-scoped or redeveloped the content and developed videos. The series is called OHP and You, or OHP and Me originally. It's on the Columbia Pacific website for people to access. I think it's under a community partner tab. And all of the content lives there, so people could look at that. Dave, I can send you the link to that directly, and then you could put it in the minutes for this group. So it does a really good job of explaining the benefits each session and their individual modules. Each session starts with kind of a basic explanation of what a CCO is and does, and then goes into a more specific benefit discussion.
Thank you, Joelle. I'd love that link for the minutes. Appreciate it very much. Although maybe it just
Okay.
popped into our, Jen, is this the link?
That's right. Yep.
Perfect. Working in real time here. Awesome. Thank you. Okay, I think we're about ready here to move on. Dana, do you want to take this next topic?
Yeah, so this was another one of those, see if we could just get like a conversation started with some of the plans around this issue, and just was curious whether other plans have seen a change in their no-shows for their provider appointments, and just trying to get a sense of, I mean, if it's pandemic related, or if, if just it's, we're kind of out of practice, or we haven't, talked about it recently, that kind of thing. So just curious if others are seeing an increase in no-shows, a decrease, and whether or not a campaign, information campaign for that is something to also consider. So I'll leave it open to the floor to see if anyone has had a chance to go back and look at their plan and has an idea.
So Dana, this is Jake from Pacific Source. I don't necessarily have a comment as an overarching comment. I'm mainly visually able to see the ones that have interpreter services attached to them. And with the uptick increase in on-site appointments for interpreter services, I have seen more of an uptick in no-shows at those appointments as well. Coming out of the pandemic era and more of those appointments going to be on-site, I have seen those increase a little bit. No data really to say how much they've increased as we continue to watch it, but I can bring more information later.
Thank you. And I imagine it's one of those topics that if it was a problem or a concern at your plan, that you would have noticed it. I mean, it would have been something you guys were talking about anyway. So it may be that no news is good news, but we were seeing it. And so just kind of wanted to know if we were alone in that, or if that was.
For me, when we talked about this, I've been thinking about it a lot, and I've wondered, and I don't know if this is a data point that we would have access to, but if there is a no-show, what is the percentage of reschedule? What's the rate that which that appointment actually gets rescheduled, and do we have a real health equity concern where if we have a no-show that service just never happens, right? Does that ever come back onto a member's schedule? I mean, I'm sure for some folks it does, but if it is tied to other arrangements like interpretive services, right? That rearrangement may feel like a pretty big hill. So I don't know if that's something that we would, from the CCO or the managed care side, that folks would have access to. But that's something that I wondered.
Yeah, we would know that, and I can find out what that rate is. I would imagine it's probably fairly high, but I and I would just be guessing, but I think there's probably, weather is a factor sometimes, and an EMT can be a factor sometimes. So, without really trying to like peanut butter spread an excuse over all of them to say that they're all because of one thing. I guess that was part of it too, was, are we seeing an increase because it just is an anomaly right now? Or are we seeing an increase because, it's been increasing over the last few months and everybody's seeing an increase. And so that kind of makes it a little bit more of a general issue and not just a specific issue. So I'm happy to let that one go. And if it's not something that other people are seeing and wanting to bring up to the group, then we'll address it with our own members and go from there. Thanks, David.
Yeah, no problem. Okay, so at this point, and I'm going to do a quick check. Siri, did you happen to join us on the off chance? Looking through the list, I don't think so. It would be too early. Okay. Catherine, then you are up. And maybe also, Catherine, if we have people who weren't here for your presentation last month, maybe give yourself another, give a quick framework of what you're working on before we kind of just dive right in.
Sounds good. Thanks, David. Hi, everyone. Thank you for allowing me to join your meeting again today. My name, excuse me, is Catherine Jones. I am with Deloitte Consulting, and we have partnered with ODHS and ODHA to redesign a series of one notices. So since last fall, we were doing a lot of community outreach to meet with Oregonians, meet with community partners, which included CCOs, and coming to this group to understand what are the barriers folks are facing when receiving notices about their benefits, whether it relates to eligibility, renewals, and requests for information. And so last time I was here, I showed one of our draft redesigns for the Medicaid Notice of Eligibility. Currently, today, I'm here to show the updated redesign based on feedback we received from this group, as well as several others that we plan to present to the state as tentatively final. I will acknowledge that this has not gone through policy or legal review, so there will probably be some comments or changes as it relates to content and some of the choices we made in terms of information we're excluding or no longer including based on feedback from Oregonians that it was confusing to them or they didn't reference. So excited to share with you another notice, and feel free, essentially gonna just walk through it. And if you have comments, pop them in the chat, raise your hand. Happy to answer questions and get your feedback today. Okay, so for those who are familiar or unfamiliar, this is a redesigned medical notice of eligibility. So folks would be receiving this notice if they've been approved, if they've been denied, discontinuances, transitioning programs, sort of updating them on the current status of their benefits.
Yeah, real quick,
yep.
Catherine, this is David. I just want to hop in and say, folks, if you're looking to make it a little bit bigger, if you hold control and then you kind of scroll with your mouse, it'll kind of expand a little bit if you need to get a closer look. Thanks.
Yeah, and I can probably bring it up a little bit too. I don't know if that helps on your end, but
yeah, definitely.
Okay, great. So the first thing we heard from Oregonians was they really want to know, like, what is the context of this letter? Why are they receiving this letter? Because they know that upfront immediately to help them make a decision around, they need to address this letter today, or they can put it down and maybe look at it later this evening. And so that's what this sort of big box up front with the exclamation point acknowledges. This notice is, you're getting this notice to let you know your benefits have changed. This content will be dynamic. So if it's approved, it'll say approved. If they are transitioning or turning 65, it'll say, you have choices, you have decisions, or excuse me, action you have to take by the time you're 65. And so there's a couple of other ones, but the default overall is really your benefits have changed for the scenarios in which folks have maybe different members in the household who different things are happening with their benefits. From there, we moved into, what you need to do. So folks wanted to know not only what is the context, but are there any actions they need to take immediately? How can we walk them through the notice really quickly so that they can jump to the right pages and find the information that they're looking for? So in this context of this scenario, folks need to review the changes to their benefits, report any changes that have been made in their household since the last time they connected with the state, and then see the next step section to get care and stay well. So essentially, your benefits have changed, report changes, and here are some options in terms of what comes next. So this resonated really well with Oregonians. They really appreciated being able to see up front, what was happening, but also leveraging icons which are carried through the notice to help them indicate different sections. This is also an issue around accessibility, helping folks, move, understand the messaging beyond just in written form. I just realized that I had closed my, there we go, the comments, so I won't be able to see in case folks are commenting. Okay. So then we just go into a general overview. You're receiving this letter to tell you about your benefits. We're here to help. Here's the number. But we heard pretty strongly from folks who oftentimes are applying for benefits or throughout their time on benefits, they might be in a crisis. And so putting urgent help information up front, these were the variety of hotlines that were shared with us that folks wanted to prioritize. And this resonated really well with Oregonians who have been in this situation themselves or could understand for someone who is in that situation how it would be useful. We've also added options to get this document in different forms so folks can have that available to them. I wanted to call attention to the footer, which is often overlooked. We've also shortened the URLs. So for folks who receive this in paper form, if they did want to visit the website, it's a shorter URL for them to type in versus the whole URL out. It will be linked in an electronic version. And we've also labeled this notice on every page. So if folks are calling in or they're communicating with you or a community partner who might not have the notice, be able to see the notice that their Oregonian is looking at, they can reference this notice here. So some of the very small details we learned that could be helpful. From there, it goes into your benefits overview section. So this section will change based on what we're sharing. So, if there are approved benefits, it'll show them and list them as we see here, essentially stating to folks that these are benefits they can use now. So we heard pretty strongly from Oregonians. They wanted to know, do they have benefits? What are those benefits? When and how can they access them? And is there anything they need to do next? And so short sentences, very clear. They're active for 1 year unless something changes, and then they will need to renew. And then we've listed by different groups. So any pregnant folks in the household, then all adults will be grouped, and then OHP kids, the kids will be grouped separately. Oregonians really liked this, so they could quickly look at, rather than that table that's kind of listing everyone and you kind of glaze over a little bit, they can very easily see, the different program and the different folks who are on that program. And then we also provided for, we eliminated that section, those multiple pages that list every single program and all the different eligibility requirements, and are now just having very short sentences that say, this is the benefits that you're covered for, and this is what the coverage includes. So folks know at a high level, what the coverage has as they move into either fee-for-service or getting information from their CCO. We also added dates, so folks were often confused around when they're active, how long they are active. And so this is tentatively active, for the year unless something changes. And so this will be stuff that we have to work with policy on around some of this language if they're comfortable, because this is currently not shared in the notices. But I will pause on this page. I did see one question. Let's see. I do not have confirmation on if the language statement is changed. So I see Jen has reached out, but I appreciate you bringing that to our attention. I will go back to our state leads and confirm, because there have been some different changes during this project. So thank you for bringing that to our attention. And Hopefully I can either share that with David, or if I am able to come to the next meeting, I can provide that update.
Catherine, this is Tiffany. I can actually just quickly update. So there is a change that we've made, and I can send it to Catherine so you have the updated language. But we just asked that there's also a reference to getting an interpreter included in that piece. So it's just like a one sentence. Yep, right there, the language access statement. So I'll send you the updated language.
Awesome. Thank you, Tiffany. And for the nurse hotline, Jaime, you're saying that it could change. Are those listed somewhere in terms of like what those different numbers are? Because we could make that dynamic depending on what their level is. By dynamic, I mean it can change based on like the number can change in the notice based on whether they're fee-for-service or CFO. So if you have that, that's the only hotline that we have currently. Great. So
I was,
go ahead.
Sorry. So yeah, I was just thinking to myself, I don't know if there's a static nurse advice line for everybody universally. I know that there are some depending on CCO enrollment or fee for service. So I can try to find a list, but essentially it should be on every CCO's website for their own nurse advice line. But I can work on getting a list to see if it's a possibility. Because the other thing that I mentioned there, and I don't know a lot about the one system, but I don't think the one system has CCO or fee for service. It doesn't tell if a member is fee for service or CCO. That's in MMIS. So if it's possible, that would be great. But I think it's wishful thinking, just from my perspective, because I don't know how the one system pulls information for notices and all that. So
yeah, that's helpful. We can verify this number to determine who who can access that number, and then it's helpful to know that the CCOs have their own, and we can direct folks to that if they in the section where we have their contacts. So thank you. Great. So from there, we've also done some small language changes. So instead of retroactive benefits, it's backdated benefits, trying to reduce the reading level, but also use language that Oregonians are familiar with or use themselves. So we've seen that in these sections. Again, so folks who are approved, but also receiving retroactive benefits. From there, we also have upcoming benefits for folks who are transitioning. So if they're eligible for Medicare, there might be options on here. Marissa is currently pregnant, so when they have the baby, they'll be able to transition. And then also for folks who are currently incarcerated, we have other examples of this, but basically this section is meant to demonstrate what would show up for folks who are transitioning. The next section, which is new, is the using your benefits section. So this was previously the stay well section if you were on the last call. So essentially this is the next step for folks. This resonated really well with Oregonians. They mentioned like holding on to this notice now so that they can refer back to it if they had questions, if they're meeting with their community partner, but just knowing what comes next beyond this letter helped ease some anxiety and help them make more confident in making decisions about their care. So this section is also dynamic. So based on whether benefits are changing, you've been approved, what will be listed here in this 1, 2, 3, etc., will be slightly different. So in this situation, it shows an example in which someone would have to make payments. So if there's any service liability, which we've now changed to cost sharing, that would show up here. If they've been approved, look for their Oregon Health ID card. We talk about options for Open Card, as well as if they're connected to a care coordinated organization, that would arrive in about 2 weeks. Was curious from this group if they we're comfortable with about 2 weeks. We know it might be sooner, but we wanted to provide a grace period for folks, so there weren't any questions around, when their packet arrives. So if that works for folks, let me know. If not, also let me know. And then we've updated this guide, what we're calling the guide on the side. So folks, oftentimes, if they're new, or maybe even if they've been on benefits for a while, might not know what CCO stands for. They might not know what open card or fee for service is. And so providing these brief summaries to help inform folks about the different actions they can take, what's involved in that process, and then once you're connected to different things you can do. Everyone will have, you have to renew once a year, you have to report changes, and you can request a hearing. Other options that show up here are folks who might be denied or discontinuance, referring them to the health exchange, as well as some more complicated sections around estate recovery, depending on their circumstance. So again, this went over really well, and we're excited to share this with the state. Any questions on this particular page, the content here? And I can also share this so folks can review it, or any concerns about listing 2 weeks for a letter from the CCO. All right. Well, again, I'll share it out, and so you can look at this in more detail, maybe up close, and feel free to send us your feedback. So the next section is also a new section. Well, it's a slightly redesigned section called the Take Action section. So this is the reporting changes tool. So we turned it into a checklist to have folks interact with this. They wanted to be able to hold on to the notice, refer back to it, and providing it with a checklist. They really liked this when we were out in Oregon, talking about being able to literally like check things off and go talk to their either their connections at the state or the community partner that they work with. And so we've listed the ones that we know to be most frequent or the ones that are required by policy. So this is telling folks they have to report a change in 10 days. And then we also updated or created a new comprehensive contact section. So we not only added the context for the state, and we're pulling the local office based on their address. We're also providing, again, the guide on the side, when to call the state, what can you get, what resources can you get from them, as well as the health contact section. So if they are connected to a community partner, or they would like to be connected to a community partner, it will be listed here. If they're currently connected to CCO, this is currently in flux in terms of how this will be designed. The call the CCO or fee for service will definitely show up. And then we did receive a table that lists all the CCOs. We haven't determined the functionality of how that will be listed. There is a discussion, to your comment, Jaime, of connecting the MMIS with the one system, but obviously that's a more structural change that could come later. So those conversations are being had because this section resonated really well for Oregonians who are connected to a CCO. And then the last part is around our QR codes. So again, this hasn't been determined whether it will be language translations, resources, or directly to the OHS OHA website. But essentially, folks will be able to hover over the QR code and be able to be directly connected to resources. So once that's determined, our team will make those updates. But folks really like that as well. So any comments on the reported change before, and the context before I move to the last section, which is policy and legal? Okay, great. So based on feedback, we've updated our policy and legal section to include the non-discrimination policy. This is stock content right now, so we need to get the final language to be added here. But also around if you're receiving Medicare, there are some policies that need to be aware of, as well as a legal statement that will be added. We have currently added the OARs, the Oregon Administrative Rules, at the end, and they are footnoted throughout the notice. So we heard pretty strongly from Oregonians and community partners that listing the OARs directly in line with the notice created a lot of confusion. They didn't know if they needed to know it. They didn't know what it meant. There was a lot of sort of shame, to be honest, around not knowing it and not feeling empowered to be able to understand the complexity of the policy and legal. And so currently we have proposed footnoting them. I'm trying to see if this one has an example. I don't think this one does, but basically in a situation where the OAR rule needs to be listed, it will be like a little footnote of like a 1, 2, 3, 4. And then they will be connected to the OAR rules at the end. And so we're working to hear from policy and legal if that is viable. If not, we'll have to rethink how we are currently listing them or go back to the original design, which lists them in line. But we're hopeful that this is, they'll meet their expectations. We've also redesigned the hearing rights section so it has the same look and feel as this notice, which you can see includes color and includes icons. And we've also rewritten some of the FAQs to be more in plain language and more accessible to broader audiences. So our hope is that folks will be able to navigate the hearing rights process a little bit easier, or at least build awareness around hearing rights more broadly. So that's where we stand. We're hoping to meet next week with the leadership to review this, as well as having a meeting with DOJ. But a lot of these design elements and features that I've shared today will be carried over into the active and passive renewal, as well as the RFI. And then we'll also be doing a content update for those, which I'm happy to share with this group as they come along. But that's it. If there are no other questions, I'll hand it back to David.
Thank you, Catherine, so much. I really appreciate you taking the time to come back and give us this update. It's really awesome. Appreciate it.
Thank you, and thank you for everyone who gave me the updates on the content, and then the language will definitely get the right statement in there.
Yeah, it looks really good.
Okay. All right, so our next topic, and I think I saw Siri. Siri, have you joined us?
I'm here.
Hello, welcome.
Thank you.
So your perfect timing here. We've got a few minutes left for your topic around the public health sunset and member impact discussion. Siri and I chatted after putting it on the agenda, and it seems like we were going to have maybe some things to react to, some things to look at, but I think it sounds like we're wanting to do. And Siri, I'll let you throw your context on this too. Is that we're looking for more of a discussion to gain what we should be aware of when we start creating some of the communication strategies. Siri, do you want to help?
Yeah. Yeah, I think I wanted to pause a more comprehensive discussion about this for now, while kind of figure out operationally who is who's in charge of all the pieces, the ongoing pieces of communications. But if any of the folks here have want to voice potential concerns that they are anticipating with this change that is kind of going back to normal. I think this is a good place to kind of address, just air them out.
Sure, and Sheila, you're one of the folks who you and I've had the most kind of conversations around, with the public health emergency ending, what would happen to a member, and what kind of notice would they be giving? What's their timeline going to look like? And so maybe I would pick on you, Sheila, to kind of get us started a little bit if you don't mind, because I think this one's been on your mind a lot this last year.
It has, and me because I had to switch phones. So yes, what we are concerned about, and I mean, I am a little bit happier that we got the extension, or that OHA got the extension to allow a year for this communication to go out to members. However, what we would like to see prior to communication going out to members, and the communication that does go out to members, is that we are able to draw that information into the specific members, David. I think we've talked about that before, being able to identify the members that are currently being redetermined only due to the state of emergency, and will there be a separate notification going out to those members, and will we be able to identify those members in advance? So my understanding is right now, members are still getting redetermined, correct?
Yes, from what I understand, correct.
Correct. So is information currently going out to those members, or, I mean, do we, I guess that's my question. So are they getting information that they still qualify, but for the members that are only qualifying due to the state of emergency, is any information being taken and given to those members, or is that just kind of sitting on the back burner? Because I guess that's my worry, is that when this is all over, we start communicating with these members, do they know that they're only qualified right now due to the state of emergency and that they may be losing their benefits? Or is this going to be two separate letters going out to these members?
I see. Yeah, I see where you're coming from, and I'm a newer person, staff here, so if anyone else can jump in if I miss something. What I've learned from the policy folks is that when a member's eligibility is up, they're still receiving the eligibility letters. Or if their eligibility changed, they're still receiving, those specific letters. But those letters don't mention, what happens after the public health emergency ends.
And
does that answer your question?
Oh, this is David Syria. I guess the question is too, with that notice, if it comes to them, and they're being kept open, or they're it's letting them know of a program change. I think what Sheila's asking is, does it let them know, by the way, you're also being held open because of the public health emergency? I think there's that other piece of information coming already to them, and I think that's a good question that I don't know the answer to either. I think that they don't know what's being told to them in that way.
Yeah, I just, some of them may understand and know, but I guess my worry is shock. So they're getting this letter saying you no longer are going to qualify for, your OHP benefit. They have a letter, and will the CCOs get informed and get copies of those letters, so that we kind of have some idea of the communication that's going out to members, who and how many this is going to affect.
Yeah, no, those are great ideas, and I wrote them down. So those are things to plan and think about. So thank you for those.
Sheila, you broke up there in that last. We lost you on that last bit.
Just want to thank everybody, and Sari, thank you for this. I think that our main concern, of course, is the members, the impact this is going to have on the members. But of course, the CCOs want to be prepared as well. So thank you for taking into consideration.
Yeah, no, I hear that. And I'm in the same boat as well as you, and the need for, right, everybody who interacts with a member to be on the same page in terms of the communication that is going out. So we're all telling members the same thing no matter who they ask. I hear what you're saying. So thank you.
Okay, if there's no other questions or feedback on that topic for now, we can table it until we're further down the line.
Thank you.
Okay, so 318 here, we're going to transition right into roundtable. Are there any discussions or topics for roundtable? Okay, any public comment before we adjourn? Okay, so it looks like that's it. Thank you guys very much. We appreciate you taking the time to join us today for the Member Engagement Outreach Committee for January. We will see you next month.
Thanks, everybody.
Thank you, David.
Thanks,
you.
David. Thank you, everyone.
Thank you.
Thank you. Bye.